Hello, and welcome to our first live webinar hosted by Global One, Framing the Future of Outpatient Care. Now to introduce our host. Scott Leggett is the co-founder of Global One, the largest commercially insured medical bundled payment network in the state of California and amongst the largest in the nation. Leggett is known for his creative mind and for being a positive disruptor in the outpatient space. His experience includes founding a network of independent, physician-owned outpatient surgery centers. In addition, he served as the president and board member of the California Ambulatory Surgery Association. It is my pleasure to introduce Scott Leggett.
Hi there, and welcome to our first webinar. So I want to make this personable, and at the end you'll have my contact information to ask questions direct, or if you want to contact me. But I want to go through a few thoughts on transparency, cutting costs through healthcare price transparency, and our Global One payment program we'll talk about at the end. So we're going to talk about transparency. And transparency, the one thing that we have to dig into is where all the cost is at. $3.5 trillion is where the healthcare spend is. We've seen that number a number of times. And we've seen, the fact that $10,000 per individual is what it's costing us for healthcare in our country. About a third of that is due to waste, and there's a lot of efforts into waste, big data, a lot of artificial intelligence, and a lot of transparency efforts in this area. The average person is going to spend more than $1 million put into the healthcare system over their working lifetime, and this is through premiums and co-pays and deductibles. And it really is the number one reason for erosion of the middle class. And if you think about it, let's break it down for a second. So you're putting, over the last 15 to 20 years, employers are experiencing these just astronomical increases in healthcare costs, 10 to 20% each year over year. It's just been unrelenting. And employers are struggling with that. And if you have depending on the margin of your company, you're trying to balance that. And a lot of times, those costs have to get, or most of the time, those costs have to get pushed down to the employees. And so that's really the erosion that's been occurring in the middle class that nobody's really talking about. And I believe you're going to hear a lot more over the coming years about this, because if you're pushing down, increases of, half that increase in the healthcare cost of the employee, and the employee's getting a 2 to 3% increase in their wages, that's a negative for them. So the salaries are actually going down, not up, because healthcare is eating into that. So what's been happening? What's driving this cost up? The one thing that's been pretty clear, it's a very complicated system, but the one thing for clear is the consolidation that's been occurring in the healthcare system. Hospital mergers, there's been 1,412 from 1998 to 2015. Just in between 2010 and 2015, there were 561 hospital mergers. What happens with this is that the hospital mergers create large health systems that can compete with leverage the insurance companies and just keep increasing the cost of healthcare, just because of the leverage that the health systems have. So mergers theoretically are supposed to create efficiencies. The argument behind it is that it creates efficiencies. You cut out a lot of fat in the system, but just the opposite has occurred. There's a great slide that I'm showing now from the Bureau of Labor Statistics. This is data from 1997 to 2017. And it basically shows that the services subjected to consumer pressure, like new cars, household furnishings, clothing, cell phone service, software, toys, TVs, everything on the bottom half of the graph are things that are subject to competition. Everything above, wages are competition, and childcare, you see some moderate increases there. But the real winner is hospital services and college. And if you have kids in college like I do, that's no surprise to you. Hospital services have jumped up over this period 300%. And again, it's the general consensus is that it has a lot to do with the consolidation, and that the health systems are leveraging up the pricing because of the dominant power they have in the various markets around the country. There's a good study released in JAMA that really really evident that the utilization is down. There's been a lot of effort around utilization in the healthcare system. We've seen those utilization trends go down, but the spending is still up. So really, it's the price is one of the major issues that we're dealing with. So if you tell somebody something long enough, you start to believe it, particularly when you can't see it. Like for many years, it took a long time to convince people that the earth wasn't flat, that it was round. And there's a common misconception around the healthcare system that you hear all the time from our politician and various people, that our healthcare system is bad. And I personally don't believe that. I believe we have a phenomenal healthcare system. What we do have is we have a billing problem and we have a pricing problem. And so just due to the way that we bill and the emergence of oligopolies and monopolies. So how do we fix that? So the guiding principle, I believe, is in competition. As the public and private payers should focus on alternative models that focus on integration without consolidation. So competition is something that's been missing in our healthcare system up to date. And I believe it's something that we're going to start seeing to change. There's a great book called Catastrophic Care by David Goldhill. He's a CEO of a telecom company. And basically goes into a lot of depth. And one of the trends that you're seeing is CEOs actually paying attention to the healthcare cost increases, because it's having such a big impact in their businesses. So when you have the CEO of companies like David Goldhill, John Turinis is another one, Dan Pittard, who used to run Rubio's, start paying a lot of attention around healthcare, then you know you have a problem. So competition is something that we have to figure out how to bring back into the healthcare system. So let's talk about transparency. How do we define it? So there's basically three basic points that I want to bring. First one is the obvious, and that's the price. So let's talk about price and a lot of things that we're starting to learn now. If you look, this is actually a bit of a dated slide, but from 2005 to 2006, the cost of total hip arthroplasty and total knee arthroplasty in the United States varied, depending on what region you're in, as much as a 34%, variation. And this is the same procedure, same cost, same actual cost of doing it, basically 34%. So this is actually a slide from a group that we work with, Healthcare Blue Book. They were nice to share with me to show you some of the tools that they have on their website. But this is basically, and actually just to back up there a step. So a lot of companies in this era of transparency, there's a lot of data available, big data. So Healthcare Blue Book is able to consolidate a lot of data, payment data. So they're actually able to see per region exactly what the costs are of a lot of these different procedures. So if you look at the low end of a cost in the little graph that they have, you can see that you go from $442 to a little over $4,000, and then you identify a fair price, which is somewhere in the middle. And the variation in pricing, and this is just not Healthcare Blue Book, but there's other companies doing this too, but it's pretty consistent that the variation in pricing goes from anywhere from 300 to 500%. The RAND study there's a nice RAND study the RAND Corporation just released that showed that the variation across the country was as high as 700% in the pricing of identical procedures. And basically the average billing on commercial was about 300% of Medicare. So let's look at some, basically a specific case. This is, again, data from Healthcare Blue Book. You can see across the, this is the actual case here. These are knee replacement prices in Nashville, Tennessee. You can see that the variation goes from anywhere from, about a little over 20,000 all the way up to about 80,000 for a total knee replacement. These are actual cases, actual payment data on total knee replacement prices in the Nashville area. So you see similar things for the outpatient services. So this is, basically for an ACL repair ranging from about $5,000 up to about, $43,000 in Seattle, Washington for an ACL repair. So this is what's led to our current executive order and current legislation, where the President Trump was directing the agencies to require insurers and hospitals to make public the negotiated prices. And so not just it's coming from the administration, but this is also, there's bipartisan legislation now being considered attacking this problem, because it's a problem that nobody understands really how to grasp, but it's definitely something that is going to have to be dealt with. But this is what's led to it. But again, it's a great effort by the administration to start to try to get at this problem by creating transparency. Alex Azar, who's our HHS director, basically said the federal spending on our major healthcare programs is projected to rise from 5.5% of our economy in 2016 to 8.9% of the entire economy, 30 years from now. By themselves, they'll consume all the income taxes from the federal government. I mean, it's just not, it's not sustainable. So we hear that over and over again. And so we have to make some efforts to, start to bring down this pricing. And transparency, competition, is really a really good start. So it's no surprise that there's major hospital pushback. Hospital associations have already sued the administration. They're trying to put a halt on this. The lobbyists, there's going to be a huge inertia over this to try to prevent this from happening, because there's a lot of money right now trying to protect the status quo. So the hospital industry is not likely to change anytime soon. So one of the ways that we feel you should do this is to start to embrace, and this is what we're starting to see the trending, is to start to embrace different venues, different value opportunities. There's outpatient surgery centers, which we'll talk about a little bit more, urgent care centers versus emergency rooms, independent labs and imaging centers. And there's no reason why you should pay $3,000 for an MRI when you can go to an independent center and get it for about $400. So you're barely scratching the surface on is quality, and that's the next point. And I think that's where the shoe is going to drop, because the quality is something that we all want. We all talk about it. It's a lot of lip service around quality, but nobody has really dug in deep to really try to tackle this one. We're just barely starting to get our head around the pricing, and that the pricing there's clear pricing differences and how we attack that and the transparency. But how do we deal with the quality? So again, from our folks at Healthcare Blue Book, here's another really good slide showing basically a green to red, and this is basically rating a physician. It's a national percentile, but it's rating physicians on the quality of knee replacement quality. And they have a few different measures, which I won't go into here, that they use. But the hospital facility quality shows the same level of variability. Actually, I mentioned this was physicians. This is actually hospital quality. So the same variability shows up for physicians. Another one of our valued partners is Quantros, and some of the work that Shane Wolverton's doing. And this basically shows a standard expected level of care, this black line across here. And so the bar up here to the right and these are individual physicians, and this is around joint replacement. So this is risk-adjusted complication index around joint replacement. And so you can see these physicians out here on the right are having way more complications than expected versus these that down here on the bottom. And you can see the big swing all the way through here. So the same variations that we see in pricing, the 300 to 700% that I mentioned earlier, those same variations exist in quality. So there's a dramatic difference in the quality as well. This is another way to look at it that Quantros breaks it down, where they have percentile scores, You can see, not to go into all these other, you can break it down in mortality and complications and readmissions, inpatient and patient safety. But overall, there's an overall ranking that occurs, and you can see that, there's 91% all the way down to 19%. Again, these are risk-adjusted quality scores. The reason we're able to do this is because of transparency in data. I mean, we're entering an age where big data is playing a big role, and there are millions and millions of data points that are starting to emerge. And there's companies like Quantros and Healthcare Blue Book that are helping us attack this and provide some very valuable data, again, very transparently around price and quality. Another big point that, talk about, to plug ASCs for a minute. It's ambulatory surgery centers we hear a lot about these days. They're independent centers that pretty much do the same surgeries that hospitals do. The complication rates are really low, 1 per 500. It's about 2 per 1,000. High patient satisfactions. And we know, it's pretty common that on any given day, there's about 1 in 25 hospital patients that has at least one healthcare associated infection. So the infection differences, and in surgery, that's the number one thing we're trying to prevent is infection. So surgery centers are a lot more controlled. They're basically the southwest of the industry when it comes to, that's all that they do is surgeries, and really are able to maintain the venues a lot tighter and keep the infections down. The downside about quality is that there's no consistent metric that has become a standard. So we have a little bit of work to do, a little consensus that'll occur over the next year or two, but you'll start seeing some standard quality metrics that will emerge, so that we can measure facility quality, we can measure physician quality, and so the patient can have that to look at. So the third piece I want to talk about is something that we don't think about a lot as far as transparency, but it's the patient experience. So it's kind of just not talked about a lot because patients are kind of expected traditionally to kind of put up with delayed offices and things like that. So the patient experience, particularly with our millennials and Gen Ys, this is going to change quite a bit. I call it the Uber phenom that is coming to healthcare. There's an Uber for everything now. The field is being leveled because of the ease of data, ease to go online. The millennials and the Gen Ys are, really fast at, accessing data. They want convenience. They want to be able to go see a doctor at their convenience. They don't want to wait in a waiting room for an hour, and they want more of a personalized experience, particularly as these younger generations are, understanding the cost. They're going to demand the cost to come down, but they're also going to demand a better patient experience. One of the other things that you'll hear a lot about is shared decision making. So there's, this is a study, and this came out of Dartmouth, but it's something that I personally think we're going to see a lot more of. And doctors are going to need to, come out of their comfort zone. In the past, doctors haven't really worried about the venue and the value in medicine, but it's going to become a standard where doctors are and providers are going to need to, educate their patients and talk to their patients. And maybe a surgery can have an opportunity to be done in a surgery center, or they can recommend that they go to an independent, imaging center, or, just basically educate them on their opportunities, or have somebody in their office do it. But the shared decision-making is not going to be just about the procedure itself, but about the venue where that procedure is going to occur. And I believe that's something that we're going to see. And of course, the ultimate patient experience is, would you recommend this provider to a friend or family member? It's really important that that patients have a good experience, and that we don't overlook that. So value, how do we define value? It's the ultimate transparency. It's 3 pieces, just to recap. It's price, quality, and the patient experience. So a few last slides I want to talk about is just, what's really going to drive this transition. And personally, I believe that it's going to be the purchasers. It's going to be the self-insured companies that's going to drive this. We hear a lot in the media about the big boys, Amazon, Berkshire, JP Morgan, Apple, Walmart, Target, Delta. There's a lot of companies that are starting to take healthcare, control their healthcare cost. They're going to start working with channel partners to direct to better value surgical sites, better value primary care docs. Last week, Walmart announced that they've been doing travel surgery to centers of excellence for a few years, but last week they announced that they were going to start redirecting their patients to doctors they're going to pick from a quality metric. So these things are happening. And in the past, a lot of people have kind of shunted off the idea that, well, this has happened in the past and nothing has really happened. But I think that these guys have sustaining power. These are the big boys. These guys have the money. And I believe that we're going to see that things will be sustained long term. A company that we work with, the MCSIG, Municipal Collegiate and School Insurance Group up in the Monterey, Salinas area, we've been working with for a few years, have shown tremendous savings around using bundle payments around their surgical costs, and they're moving a lot of cases from the local hospitals into the local surgery centers to save tremendous costs. And it's been $7 million to date. I think it's actually even a little bit higher now, probably closer to $8 million. A great example I like of an employer that kind of took things and kind of ran with it in their own way is Harris Rosen. It's a great story in the Orlando area. Mr. Rosen, in the early 70s, bought a hotel. To turn it around, he was working 5 jobs. It's an all-American story where he really worked his butt off. He built the company up, had multiple sites, and he realized in the early 90s that he was just getting killed with his healthcare cost. So he ignored all the advisors, kind of went just a basic common sense approach. He hired his own primary care docs. He made it a personalized approach to primary care. Started doing bundle payments and prevention programs, and the money he saved, he reinvested back in his employer. So he basically, now they're up to probably over 500 college scholarships now that they've paid. They've reinvested in the high schools and in their local communities. Their crime's down, graduation are up, and so it's just a great example of what can be done with all that wasted money that he was spinning off into healthcare. And now they're continuing to reinvest in their community, and they're actually teaching other companies how to do what they've done successfully. So a little bit about Global One. We've been around for about 10 years now. More active in the last 5 years as we've been building a network with Blue Shield and some other payors and self-insured companies in California. We're now in a couple of different states, but we provide a bundle payment pricing around surgery centers. We have about a little over 70 different types of bundles. And the cases when a patient comes to us, once they're scheduled in a physician's office and we're working with that employer or that insurance company, the patient through our call center will know exactly what that price is. There's one price, one deductible, copay, one EOB. It's just a one-stop service. It's just a great transparent way for the patient to know exactly what they're paying up front, rather than getting a big surprise at the end. And it's a way, certainly it's not the only answer, but it's a really, really good step in the right direction around transparency and helping bring the cost of healthcare down.